Hello, this is Tessa Kegel and this is HBS 5 OHC, Personal Assessment Monitoring and Pre-Employment Screening, and this is Module 9, Part 3. This is the Commonwealth of Australia Copyright Act 1968, and this covers these sets of lectures. So now we move on to workplace drug and alcohol testing. Now, workplace drug and alcohol testing is becoming more common in the workplace. However, this type of workplace testing is particularly controversial. Now, there are a range of different tests for workplace drug and alcohol intoxication. However, apart from breath testing for alcohol use, there are no reliable tests for current intoxication or impairment due to the use of drugs or alcohol. We will continue with some discussion with this through the readings and activities at the end of this module. So, who performs employment and worker screening? Sometimes a simple questionnaire pre-employment may be administered by the personnel department in an organisation. This may require the employee to provide information about their health status and pre-existing conditions. In many workplaces, pre-employment screening is administered by an occupational health nurse or doctor, or a person's own doctor may be asked to perform the assessment. Psychological profiling is commonly undertaken prior to employment, usually by HR staff. Legal questions might arise regarding the level of expertise of the assessor and the detail and security of what is recorded. Some tests are only undertaken by registered practitioners. For example, in some jurisdictions, a functional capacity evaluation can only be undertaken by an occupational therapist, a physiotherapist, or an occupational physician. Audiometric testing can only be performed by qualified testers. Decisions about the intrusiveness and the appropriateness of tests must also be considered. An example often given to illustrate the inadequacy of some of this testing is that of back and neck X-rays as screening tools. As we've previously discussed, Waddell and Burton have pointed out that taking X-rays or imaging of any group of people will show a large percentage with abnormalities, but no symptoms or disabilities. Any intrusive test should be questioned its relationship to the job and tasks required. The question of who performs pre-employment screening also relates to the ownership of the personal medical file of an employee. The workplace is not a medical clinic, and confidentiality of personal details remains a difficult issue. Not all workplaces have health professionals on staff, and not all OHS practitioners have a health science background or an understanding of medical ethics. A locked area with access only to medical staff is suggested in most OHS management systems, but the reality may be quite different. Employers are entitled to know whether the person is deemed fit for the job, but not any detail of the person's medical condition unrelated to the job. At a practical level, the OHS practitioner has to make a number of decisions. What will the pre-employment screening cover? Who will perform it? Will it be within the organisation or performed by an outside practitioner? What reporting mechanism will be used? Who will have access to personal records? What will the organisation do with negative pre-employment screening outcomes? Can they modify the work environment to enable the person to work without risk themselves or others? And what recommendations should be given to the workplace? Smedley et al. Recommended the goal of occupational health assessments should be to achieve the best possible fit between the worker and the job requirements. They recommend that both the rationale for the assessment procedure and the specific requirements need to be documented and available for all parties. Further, the pros and steps to be taken where an individual does not meet the specified criteria need to be stipulated and transparent for all parties. Fitness for work assessments may include collecting worker or prospective worker data, including physical characteristics, sensory capacities, function testing, and major systems review. A systems review may be a checklist or may be an individual medical or health examination. So this could include cardiovascular, respiratory, visual, ear, nose, throat, gastrointestinal, musculoskeletal, and neurological systems. For some workplaces, psychological and neuropsychological screening may also be important. One thing that most writers recommend is that past and present occupational history, looking for issues such as past injuries, hours worked, shift work, tasks undertaken, and exposure to toxins, is the most relevant form of assessment. So, in conclusion, the screening procedures and tests undertaken for pre-employment screening or drug and alcohol screening should be relevant to the job requirements. As an OHS practitioner, you should be aware of the legal requirements regarding assessing workers' health information. These are the references which we drew on for this module.